Thank you for listening to Depictions Media Radio.
Dr. Caressa Etienne, Director of the Pan American Health Organization, is warning the Americas around controlling the vaccination doses of COVID-19. She's saying that it will take years as the slow pace of vaccination continues the way it is. The PAHO Director quoted, in some cases, not even 1% of the population in the countries have been vaccinated. In other countries, the figure is only about 3%. The director is calling for urgency ramp-up of access to vaccines and urges countries to contribute doses and financial resources to those countries that are having trouble financially gaining the doses that they need.
Hola, ¿qué tal? Muy buenos días.
Hello, good morning, and thank you for joining us on our weekly press briefing of the Pan American World Health Organization on this Wednesday, June 9, 2021. I am Sebastián Olier from the Communication Department of PAHO, and the session will last 1 hour as it usually does. We have received some questions through email, and you will be able to use both the chat and the Q&A buttons to ask questions. Please always remember to include your name and medium when you send your questions off. We also have simultaneous interpretation into English, Portuguese, French, and Spanish, and you can use your choice of language by clicking on the globe interpretation function. Dr. Caressa Etienne, Director of PAHO, will give you an update of the situation of vaccination, the status of COVID-19, and also access inequity for vaccines. Dr. Etienne is accompanied by Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Director of the Department of Health Emergencies, and Dr. Sylvain Aldeguerri, Incident Manager for COVID-19, both also from PAHO. Now I invite Dr. Etienne to give her introductory remarks.
And let me wish all of you a pleasant good morning. And we thank you again for joining today's press briefing. Last week, there were almost 1.2 million new COVID-19 cases and over 34,000 new deaths reported in the Americas. And 4 of the 5 countries with the highest death counts in the world were right here in our region. While COVID-19 infections are slowing across North America, localized jumps in COVID-related deaths are being reported in some states in the United States and Mexico, and in some provinces in Canada. In the Caribbean, Trinidad and Tobago reported the largest spike in COVID-19 infections and deaths over the past months, while hospitalizations in Haiti continue to stretch the country's oxygen supplies. While infections are finally coming down in Costa Rica after weeks of accelerating cases, other Central American countries like Panama and Guatemala are still reporting a rise in new infections. In South America, Ecuador, Brazil, and Peru are seeing a reduction in cases, but most of the continent is reporting a surge in new infections, including Argentina, Uruguay, and Chile. Bolivia and Colombia are witnessing a rise in both cases and deaths over the past 2 weeks, and ICU beds are almost at capacity in many Colombian cities. The trends that we're seeing are clear. Across our region, this year has been worse than last year. In many places, infections are higher now than at any point during this pandemic. The emergence of new variants has added new complexities to our epidemiological surveillance. And despite the doubling or even the tripling of hospital beds across the region, ICU beds are full, oxygen is running low, and health workers are overwhelmed. And while it is true that vaccines will eventually help us curb the spread of the virus, progress has been uneven. In fact, today we're seeing the emergence of two worlds, one quickly returning to normal, and another where recovery remains a distant future. And the differences are stark. Only one country, the United States, has fully vaccinated more than 40% of its population. Even countries that have had vaccination campaigns for months, like Ecuador, Peru, and Bolivia, have still only managed to protect around 3% of their populations. And this situation is particularly acute in Central America and the Caribbean. Just 2 million people have been fully vaccinated in Central America, and less than 3 million in the Caribbean. Some countries like Guatemala, Trinidad and Tobago, and Honduras have yet to administer enough doses to protect just 1% of their populations. The inequities in vaccination coverage are undeniable. Unfortunately, vaccine supply is concentrated in a few nations while most of the world waits for doses to trickle down. Although COVID-19 vaccines are new, the story isn't. Inequality has too often dictated who has the right to health. We can't let this happen again, and we know how. First, we urgently need to ramp up access to vaccines in the Americas. While we need more doses everywhere, the countries at greatest risk, where vaccines have been slowest to arrive, and even where vulnerable populations have yet to be protected, these countries urgently need more vaccines. We are thankful for the United States government's decision to donate an initial 6 million doses to countries in Latin America and the Caribbean. Spain has also generously donated 5 million doses to Latin America and the Caribbean. And we are so grateful to Canada, which has committed 50 million Canadian dollars to expand access to COVID-19 vaccines in the region. We hope that other countries, particularly those with excess doses and global financial institutions, will follow in the footsteps to provide the support that we need to protect the 70% of our population that will not be covered under COVAX. Second, we need to do everything that we can to drive down transmission. Despite the precarious situation that we are seeing throughout the Americas, public health measures are being relaxed as if numbers were going down, and they are not. Public health measures have never been so important. Hospitals are at their limit with almost no room to expand care in many countries. To stop this virus, we also need strong surveillance systems that are backed by regular testing and contact tracing. This will remain critical to controlling this virus even as vaccine coverage expands and cases drop. And finally, it's worth mentioning that we must let science lead the way. This virus has been extensively researched. Treatments and vaccines have undergone rigorous testing, And global institutions like the WHO and PAHO are continuing to update guidance based on the latest available evidence. We urge countries to use this guidance and focus on what works. Unproven treatments must be studied in the realm of clinical trials, not promoted for political gain, while patients are made more vulnerable by embracing strategies that don't work. As we look to the months ahead, we must remember that the decisions we take will affect our collective ability to control this virus. If current trends continue, the health, social, and economic disparities in our region will grow even larger, and it will be years before we control this virus in the Americas. But by working together, we can limit the spread of COVID-19. We can move closer to a more equal world and fulfill our promise of health for all.
Muchas gracias, doctora Etienne. Vamos a continuar con la parte ahora de preguntas.
Thank you very much, Dr. Etienne. Now we are going to proceed with our questions that have been sent both on email and also on the Q&A. And please, I remind you to give us your name and medium when you send your questions. The first question is from Heather Brown. It is in English. She's from WCCO This Morning and Mid-Morning Anchor from Good Question Reporter. The question:
pandemic is over. What markers would tell us that? Dr. Barbosa?
Thank you, Heather, for this question. Unfortunately, we cannot predict now when the pandemic will be over. We know that all the countries are doing the best efforts to reduce the transmission, but as the director just mentioned, we still have countries in our region and in other regions of the world that are experiencing an increase in the number of cases and deaths. So that we need to first increase the access to vaccines. We have some models that tell us that if we don't reach at least 70% or more of the population full vaccinated, not only with one dose, but fully vaccinated. And if we don't implement the comprehensive package of measures that can reduce the transmission, we will not be able to control the transmission to reduce the impact of COVID-19. The indicators that we use to measure the diseases in general are related to morbidity, mortality, the level of occupancy in bed hospitals and UCIs and others. So we can only say that the pandemic is over when we will have only isolated cases or no cases at all, and the pandemic will not have the important impact that it has now, not only on the health of the populations, but also on the social and economic areas of each country. So let's work together, because we still have a lot of work to be performed in the next months. Thank you.
Gracias, doctor. La próxima pregunta.
Thank you, doctor. The next question is from Chandra Prince from Health Policy Watch. It's also in English, and it reads:
number of reputable data websites indicate a 33.8% spike in COVID-19 cases in South America this week. What is driving the latest spikes in new infections? Can you please elaborate? And also, what are PAHO WHO's concerns about this increase? Dr. Alighieri?
Thank you for the question. You mentioned reputable data websites. I'd like to suggest to add the PAHO website, which is updated on a daily basis and reflects all reports channeled by the 50 member states and territories in the Americas under the International Health Regulation. We are connected with the 50 member states and territories 24/7, and this information is reflected on our site. But first, please note that we have a mosaic. We use a lot this word, a mosaic of different epidemiological patterns in the region of the Americas. This includes data from North America, Central America, South America, and the Caribbean. Really different patterns. But overall, the trend in the region of the Americas has been decreasing over the last 4-6 weeks. This is mainly related to decreasing trends in North America. But during the same period, we have observed increasing trends and sometimes dramatic increasing trends in some countries of the Andes, as Colombia, and in the Guyanese Shield, as French Guiana, Guyana, Suriname. In addition, I would like to flag the Southern Cone region, Chile, Argentina, Paraguay, Uruguay, and also the southern states of Brazil. This is in this sub-region that we have seen fluctuating trend at higher incidence levels. So some more details on this. The temperate areas of this sub-region at the southern tip of the continent are now in the seasonal period where we know that influenza and other respiratory viruses have historically impacted most. And we have seen a similar effect last year for COVID-19 with increase during the same season. It is thus possible that the season is more conducive for COVID-19 transmission. Another element is probably the wariness of the population to stick to the recommendations on the public health measures and social distancing. As all along this pandemic, our first concern is, of course, about the continued toll of this pandemic in terms of lives lost. In this context, the main concern is for the health services to be able to cope with the surge in cases, and that they are able to keep providing specialized care at optimal standards when vaccinations activities are expanding step by step. So I hope I have answered the two pieces, the two parts of the question of the journalist. Thank you.
Gracias, doctor. Siguiente pregunta nos llegó de Dora.
Thank you, Doctor. Next question is from Dora Rodriguez from El Último de la Semana, Radio Gran Rosario from Argentina. And it is, what is PAHO's position regarding the America's Cup, and specifically taking place in Brazil, given its epidemiological situation? Dr. Ciro Ugarte, thank you, Ms. Rodriguez, for your question. Events with great crowds, with people traveling in from distant areas, has a great impact in terms of planning and also in terms of the evaluation and management of all kinds of risks. One of them is the health risk, of course. PAHO provides advice to countries and institutions that so request regarding these meetings that have great crowds attached to them. We consider that risk is higher during the COVID-19 pandemic, and any country that wishes to organize these kinds of events must be extremely careful and work with all internal and external partners so that the risk be decreased as much as possible. One of the sectors that should actively participate in this process of risk evaluation is the health sector, which is up to date in terms of community transmission, both locally and from the places where people are coming. And in the places where these events will take place, the health sector is well aware of the availability of health services and protection measures to be taken by the population and the crowds participating in these events. Ultimately, we cannot guarantee an effective management of the risk, especially in the context of community transmission. The organizers should reconsider or defer holding this event up until that point when conditions are more favorable and when the risk is within the manageable level. Of course, we can never guarantee that risk will be zero. This is impossible. But under the current conditions, we need to be extremely careful to continue on planning and developing these events because this is, again, a sign of reopening of the economy. And it is an area where the population is looking forward to having a time of diversion, relaxation, fun activities vis-a-vis what has been happening in the past, and also at the same time maintaining the health of the population. Thank you. The next few questions are from Marcela Areles Pliquet from Diario Financiero Chile and from El Chas, from Ernesto Londoño from the New York Times. And the question is in English.
Despite the advanced vaccination levels, the cases are on record levels in Chile. So what is the state of the pandemic in Chile and what forecast do you do? Y Ernesto Londoño, similar pregunta, how do you explain the surge in new infections and hospitalizations, and what does it tell us about the efficacy of vaccines used in that country? Dr. Barbosa?
Thank you for these two questions. They are really very important, not only for Chile, but also for the countries in our region. Chile is doing a very important effort to guarantee the access of vaccines to their population, and it's important to recognize this effort. Chile has already reached a very important immunization coverage for people with 50 years, people of 50 years and more. This is around the 80%. This is a remarkable success. But the second dose coverage is much lower among younger people. Only 30% among people aged 18 to 39 years, and around 60% for people around the 40 to 49 years. So we can only expect that a person will be fully protected when this person gets not only one dose, but the two doses. Second, all the estimation, the models that we have now are estimating that we need immunization coverage over than 70% at least to produce some impact on the transmission. For this reason, we need to combine the access to vaccines with the public health measures. And it's also important to remind that the performance of the vaccines are different. Maybe with the data that we are collecting now, and the PAHO is supporting the countries and encouraging the countries to perform effectiveness study, to have cohort studies that can provide more data, but probably the performance of the different vaccines is also different after the first dose. So we need to keep the recommendation that one person can be protected when this person gets the two doses, and in the situation that is still community transmission in the country or in the city, in the state, this person should keep all the protective measures, wearing masks, keep social physical distances, and the other measures. There is a very good study now in Chile, a cohort study that is following people that are getting vaccine, and they are showing that in this group that got the two doses, the protection against severe cases that require hospitalization and deaths are around 85%. So this is a very important indicator, but this will not translate automatically in the reduction of the number of cases. So we need to keep all the public health measures, and it's very important to encourage people that receive the first dose to get the second dose and to be fully protected. Thank you.
Muchas gracias, doctor Barbosa. Quisiera
Thank you, Dr. Barbosa. I would like to ask Valeria Roman from Argentina. Yes, Valeria, go ahead. Hello, everyone. My question is this. There are scientists in Peru, Argentina, Uruguay, Colombia, Ecuador, and Colombia who have detected the C37 variant, and it is being called the Andean variant. In Argentina, in a project, they have asked that it be declared variant of concern because there has been an increase in this C37 variant in the samples of patients in the specimens. My question is PAHO going to classify C37 as a regional variant of concern, or will it recommend the World Health Organization to include this variant within its variant classification globally? Yes, in addition to this question, Chris Vilches supplements with this question from Peru. What actions are being taken by PAHO vis-a-vis what Peru reported that the C37 variant is predominant in 80% of cases in the country? And an additional question is this C37 variant a variant of concern? Because this second wave in Peru has led to 97,000 deaths due to coronavirus. Dr. Aldeguerri. Yes, thank you very much for your questions from Ms. Valeria Roman and Chris Vilches. These questions have connected aspects. So let me try and combine my points in answering. The C37 variant has been detected mainly in Peru and Chile, where transmission of this variant has increased in the past 3 months. It has also been sporadically detected in the United States, Brazil, Ecuador, Mexico, and Argentina. Given that this variant has been detected also in some European countries, at present, the genomics working group from WHO, which includes PAHO experts as well, is determining whether to support this as a variant of interest or a variant of concern. To this point, however, there is not sufficient evidence to classify this variant as either a variant of interest or variant of concern, and it has not been demonstrated that it is more aggressive, lethal, or that it is not covered by vaccination. Also, there has been a localized increase only in some geographic areas and not in an extended, comprehensive way or predominant way in several countries. Now, regarding specific questions for Peru regarding the C37 variant, the process by which lineage displaces one for another in a geographic area is an expected phenomenon that has been observed in several countries, not only in our region, but in other regions of the world as well. Nevertheless, it is important to stress the work of genomic surveillance carried out in Peru, which has allowed them to determine which are the variants that are more widely circulating in that country. In this surveillance work, which needs to be strengthened and maintained regularly, there should be tight cooperation with the national epidemiological surveillance to identify changes in the behavior of the virus or change in the clinical formal presentation of the disease. I would like to take this opportunity to stress that each country is autonomous to classify either nationally or locally a variant as of concern or interest according to their own analyses, their epidemiological studies, their transmission patterns, and their own risk assessments. But let me finish with a significant point, and it is this. We should emphasize that to this point, all prevention and control public health measures, including availability of vaccines, have demonstrated to be efficient tools to stop transmission of SARS-CoV-2 virus, regardless of the type of variant, whether a variant of interest or a variant of concern, or any other of the many, many, many variants that are co-circulated at present, both in the world and in the Americas in particular. I hope I have answered the concerns of the two journalists. Thank you very much.
Thank you very much, Doctor. And the next question is by Sofia Villamil from the New York Times. And she's asking, how can you handle the economic problems in the region given the rise in the number of cases? Dr. Etienne.
So let me thank Sophia for this question. Let me begin by making the point that inequality is fueling this pandemic. And we may say that this has always been true. It has been borne out both within countries where we have seen that certain population groups have had greater transmission and have worse outcomes than others within that country, but also that access to vaccine is allowing some countries to return to more normal times, while others have to implement stricter measures to control outbreaks. The economic impact over the course of last year has really been unprecedented. A recent report by the IMF indicates that economies in Latin America and the Caribbean had the sharpest contraction in the world in 2020, and that's far exceeding the global slowdown of 3.3%. But countries now face a larger crisis than they had last year, while their resources at the same time are becoming even scarcer. But there is no worse threat to the economic health of a country than an active outbreak like a pandemic. We need to prioritize and focus the response to make the most of our efforts. The first priority should be bringing transmission under control with public health measures. For example, the wearing of masks, social distancing, the limiting of large indoor gatherings, those are both effective measures that have the power to disrupt transmission, and they don't cost much. When we apply these and other measures properly, guided by surveillance, countries can limit the impact on their health systems, on their economies, and it can save lives. But let's face it, vaccines are our long-term solution for this crisis. And it is only with enough coverage that countries will be able to fully relax the public health measures. And it is only then that economies can really be restarted and that we can begin the road to economic recovery and economic well-being. We have always said that prevention is the best investment. And this is especially true for COVID-19. Public health measures coupled with vaccines are our best way to prevent new cases, to ultimately stop the pandemic, and to begin to recover in terms of the economy and the social situation of our countries. Thank you.
Gracias, doctora Etienne. La próxima
Thank you,
pregunta.
Dr. Etienne. The next question is by Marta Rodriguez from Justicial TV in Mexico, who's saying that the reporting of cases in Quintana Roo and Baja California are linked to international tourism. Should we rethink the interruption of these activities to halt the increase in the number of cases? Dr. Ugarte, thank you very much, Sebastian, for this question. Marta, the issue of tourism has been present in this discussion at the domestic and international levels, and it is a current issue, even more so when vaccination is making progress and social distancing measures and the closing of borders have become more flexible. In the case of Mexico, the opening of tourism represents a risk for the transmission of COVID-19 through international tourists, but with the reactivation of the tourism and other sectors, we need to know the risk and be able to manage the risk properly. We know that the measures that are part of the cornerstone of control for the pandemic continue to be enforced. And they are enforced in areas where we have community transmission, but also in areas without community transmission. This is the detection of cases, lab tests to confirm cases, the isolation of suspected cases and confirmed cases, and also the quarantine of case contacts. These measures that are very important and that have also shown to be effective when applied permanently throughout the national territory will more easily control the pandemic and will promote economic reopening. I would like to highlight that within this context, the technical position of all of the experts and the organization is that there is no justification for quarantining international travelers and considering them COVID cases beforehand. And in connection with the Yucatan Peninsula and the Baja California Isthmus, these states are linked to tourism, but this is an issue that has to be analyzed, and both problems could be related to other issues and other effects that Dr. Sylvain Aldigueri could refer to. I would only like to highlight that we have been informed that the federal authorities and the state authorities are in close contact to reduce the number of cases and also to be able to establish the control measures in those countries. It is not a good idea to link the outbreaks to international tourism ahead of time, and also the implementation that I just mentioned is a key element for the economic reopening, but also for the protection of the population. Sylvain? I would like to add another question that we received in connection with Mexico by Natalia Vitela from Reforma, and she was asking whether you are expecting to have an increase of cases because of the situation in Baja California. Thank you for the second question within the Mexican context. I think that both questions need to be related or need to be reflected in the analysis of the epidemiological situation. Mexico is reporting daily based on the international health regulations, and we are provided with updated tables, information that also has a yellow, red, and orange system of traffic lights that allows us to see the current trends in the 32 federal states and in the federal district. In this week, there is no state that is classified with a red light, even though the trend is downward in most states. Baja California, Tabasco, Yucatan had an increase to the next level in the orange, to the orange color. We have a total of 4 federal entities, and this is also related to the comments and the situation described by Dr. Ugarte in connection with tourism. The Sinaloa, Sonora, Campeche, and Veracruz reached yellow. Contrary to this, the City of Mexico, the State of Mexico, Michoacán, Puebla, Zacatecas went down to the green level. Clearly, the situation in states where there is a higher touristic activity, such as the Yucatan Peninsula and 3 other states, as well as the 3 states of Baja California, need to be clearly assessed because of their international and national connections. We have been informed of close contacts with risk situations in those country areas, with the reactivation of the preventive measures and also a promotion of vaccination. To be able to change a curve, we need to have the maximum number of individuals vaccinated as soon as possible to have an impact on the dynamics of COVID-19 transmission and to save more lives. The current 25% coverage among adults should be increased significantly. But this comment applies to all of the countries in the region. It is important to remember that the first impact of the vaccination campaign is to save lives among riskier groups of the population, and in a second stage to also attain higher coverage among the general population to have an impact on the dynamics of transmission. Vaccination or the vaccination activities have also to be implemented with communication on vaccine benefits and also communication regarding the risks when relaxing public health measures, as we are seeing in some countries. I hope I have covered and expanded comments on aspects related to tourism and the trends in the Federal Republic of Mexico. Thank you. Thank you both. We have several questions related to COVAX. One of them is by Catherine Joseph from Observer Media in Antigua and Barbuda, and the question in English is:
Set to receive its last shipment through COVAX later today. Would there be opportunities in the future to get COVID vaccines through this method as shortages persist? Y también otra pregunta sobre COVAX viene de Jean-Pierre Serna de América Televisión en Perú.
And we have another question from America TV in Peru, and it is whether Peru should receive extra doses of COVAX through COVAX to protect their population, since the hospitals are still collapsed and the vaccination period is system is very slow.
I will start with the question from Kadim. Kadim, yes, we are now the PAHO's revolving fund as one of the 2 procurement mechanisms that are working on behalf of COVAX, are concluding the deployment of the 3rd round of deployments in the region. We are still pending 5 countries that we are working with the producers, but as of today, we have delivered around 20 million doses for the countries in the region. We are already working on the 4th and 5th waves of deployment that will cover the period from July to until September. And for this round, we will have vaccines from AstraZeneca, different sites of AstraZeneca, Janssen, and Pfizer. It is important also to highlight, as our director mentioned in the initial remarks, that the access is still very limited for the countries in Latin America and the Caribbean, because COVAX is experiencing many difficulties with some producers. I said Institute of India, because the exports are still banned by the government of India. There are very high-level negotiations with the government of India trying to receive an authorization that allows the Serum Institute of India to deploy the vaccines that were contracted with this producer. There were also problems with other producers that are offering a very, very limited quantity of vaccines, but the process is moving. What we certainly need for the short term is that it could be very important to receive donations through COVAX. COVAX can be a platform to receive donations from developed countries, so that we can cover this gap, this very limited access that the countries still have in the region. So this is a combination of efforts, trying to expand, trying to have more vaccines being delivered by the producers to the mechanism, to COVAX facility, and at the same time to call upon the donations from the developed countries to have a faster and more important access from the countries in Latin America and the Caribbean. Sobre la pregunta de la situación
in connection with the question about the situation in Peru, PAHO has already proposed some time ago that COVAX should also use an epidemiological risk criterion, not to identify quantities, since quantities are proportional to the population. Most of the countries have asked enough vaccines to protect about 20% of their population. So all of the countries will be receiving the amounts, the quantities that they have contracted with COVAX, but we think that it is important for the list for the delivery to take into account not only the random allocation through the committee formed by Gavi and WHO, but also take into account those countries that are in a higher risk situation. The situation in Latin America and the Caribbean does warrant to have these countries in a higher priority situation to receive vaccines before than other countries that do not have such a high rate of transmission, and so that at the end of the day they are all receiving in a proportional manner, but those that are at higher risk may receive the vaccines faster. This is important, and it is important for the countries from the region that are part of the COVAX facility and the governing bodies to support this proposal, because it will be very useful for the region, and we already have a good discussion for this to be used in what we call the second phase of the COVAX facility. Thank you. Thank you, Doctor. The next question regarding Venezuela. We have several questions sent via email and via chat. Julia Simicol from Reuters, also Laura Barras from EFE, and then also Efecto Concuyo. And the questions are as follows. Last week, Venezuela asserted that COVAX was in debt with the country. Could you please explain how the COVAX situation is going on in the country, and also whether the payment was made, when the vaccines would arrive, and how many doses? Dr. Ugarte. These are relatively easy questions, but very important. I would like to mention that the processes for the COVAX facility to assign vaccines or to make vaccines available to Venezuela are underway. This is part of the new distribution of vaccines mentioned by Dr. Yarbas Barbosa, and this will be made public in the upcoming week. The type of vaccine and the quantity will be reported in due course. And when those vaccines are available, Venezuela, based on the agreement it currently has, will decide whether the vaccine that is available is the vaccine to be accepted and what the quantity will be. As to the information on payment, so far we do not have any confirmation that the payment has been completed. That is to say, there's still a 10 million balance that is outstanding, and we hope that the COVAX facility makes a decision that is favorable for the people of Venezuela and for the countries of the region, and this decision will also be linked to other internal processes that need to be underway. And to that end, I would also like to mention that all of the domestic and international parties are open to attaining the highest number of vaccines in the shortest amount of time for Venezuela. And to that end, I think that there are several joint opinions regarding that process, but at the same time, there is the concern that it is necessary to make progress with more attention paid to internal processes and also to the payment that has to be made and the type of vaccine that, as I mentioned before, will be available. I do not think that those vaccines will be available soonest, but this is a process that is affecting everyone, and this is affecting all of the countries of the region, and this may be due that not all of the countries have received the vaccine through COVAX. Thank you. The next question is by Katia Rojas Tono from Panama, and it says that the United Kingdom is showing a rapid increase in the incidence of COVID-19 cases due to the Delta variant. How dangerous is Delta for the pandemic, and how is the rate of transmission as compared to Alpha? Dr. Aldigueri. As the journalist said, in connection with the UK, it is important to consider the epidemiological situation, and the active vaccination campaign. The rate of new cases has been 5,600 cases a day, and the number of deaths reached 7 a day. In the United Kingdom, since late May, we have seen an increase in trends after the detection of the Delta variant, because it now indicates a higher that have been reported by the health authorities in the country. Now, the process for the lineage of the SARS-CoV-2 to replace other lineages in a geographical area with high transmission is an expected process and phenomenon that has been expressed in several countries. Now, the Delta variant, that is a sublineage of that variant, that is B1C617.2, that Delta variant has been detected and sequenced in 9 countries and territories in North America, South America, and the Caribbean. The Delta variant has proven to have a higher transmission rate when compared to other variants such as Alpha. However, that variant is not particularly aggressive, and we have seen that all of the licensed vaccines are efficient against that variant. And so vaccination, together with all of the measures, including the public health measures, should be maintained to control transmission. So I hope I have answered the question by Panama. Thank you, Doctor. The next question is by Matias Loerwi from Medcap in Spanish, and it says that Spain decided to authorize the entry of tourists that have been vaccinated with vaccines authorized by WHO or EMA, and that leaves millions of Latin American individuals that received other vaccines that have not been endorsed by these agencies. This is the power each country has, but they're asking whether this has any logic in the public health area, in particular because of the message that is communicated through health agencies is that vaccines should not be elected, but that the first one available should be applied.
Gracias por la pregunta, Matías. La OPS y la OMS.
Thank you for the question, Matthias. PAHO and WHO, when this debate started a couple of weeks ago regarding the request of vaccines to authorize the entry of tourists, has indicated that in a situation in the world where there is such a limited access to vaccines by the countries, these regulations may enhance the inequality in access and also expand inequalities within the countries and among the countries. But as Dr. Ugarte has mentioned, it is important to maintain all of the surveillance and prevention measures so that the countries that are going to reopen tourism can do it cautiously so that all of the prevention measures can be maintained. As the journalist mentioned, this is a decision to be made by each country, but it is a decision that at this point in time could be more of an element to enhance inequalities. So we need to look for rapid control, because if we attain these measures and what measures can be administered, what vaccines are going to be accepted or not, we are going to create a bureaucracy for the verification of vaccines where it would be more effective to guarantee that vaccines are available with more equality so that we can attain control of transmission throughout the world and in all of the countries. Thank you. Thank you, Doctor. Now the following question by Livia Lopez from La Prensa in Nicaragua. What is your opinion about the vaccination process in Nicaragua? She's saying that the health ministry halted the application of the first doses, but they do not know what the scope of this process has been. Dr. Ugarte.
Bueno, no tenemos, Nicaragua no ha
Well, Nicaragua has not reported on the details of their vaccination process. However, through official media, they have given information about the timetable of the second doses, stating the municipalities where vaccination would be provided. So that's the available information. We also have information that at this point in time, the government has the necessary doses to complete the full schedule for those who receive the first dose. The Ministry of Health, as you know, started vaccination on April 7th, and up to today, it's 9 weeks of the first doses, and so it's the day to begin giving the second dose. So in this sense, the timetable is in accordance with the times we mentioned. Of course, the more detailed information we get, the better it is for both the population and the planning processes to be able to be carried out appropriately so that vaccination is timely and will protect populations who are high priority or high risk and are in the priority groups in order to reduce deaths in those groups and avoid serious cases. This is almost the end of our press briefing. It has to do with vaccine production in the region.
The Caribbean have to do to expand production of COVID-19 vaccines in the region. Dr. Etienne?
Thank you for this really very important question. In a context where there is limited doses available and where some countries have pre-bought large quantities of the limited doses that are available, vaccine donations are essential in the short term. The current supply is limited and most of it is being held by a small number of countries. According to some estimates, the European Union and 7 high-income countries have a surplus of 1.07 billion doses in 2021. And these vaccines must be used to save lives now. So we make an urgent call to the upcoming G7 meeting to address this need and to help expedite donations from countries with surplus vaccines, but also from countries who have large numbers of doses and who have not yet reached their targets, but they must give out of this because they need to protect other countries as well so they can protect themselves. But I think we need to look ahead and to consider that we will only have supply security when the manufacturing capacity is expanded in Latin America and the Caribbean. This is important for the sake of our public health, our national securities, and our economies. But we are not there yet. For example, in 2018, the trade balance for the pharmaceutical sector in the Americas was striking. In Latin America and the Caribbean, we imported roughly 10 times more than we exported in terms of health technologies, pharmaceuticals, vaccines, and equipment and supplies. So there is no question that this inability to have sufficient production has made us more vulnerable during this pandemic. But we are not starting from scratch. Our region does have established capacity for manufacturing vaccines across several countries, and we have helped protect generations from diseases such as yellow fever, meningitis, and influenza. Also, we do have a very strong regulatory networks, agencies, and harmonization, which are key to guarantee the quality and the safety of vaccines. And this is a very important part of building production and to become self-sufficient. So we need to build on this foundation to update and expand our ability to manufacture vaccines. And I am quick to add, not just vaccines for COVID-19, but vaccines for the common vaccine preventable diseases, but also for supplies and also for essential medications. But for this to happen, we must have political will, and there must be investment from within the region, and that will be key. We will also need the support of international partners. So yesterday I told an economic forum in Argentina that we need to address self-sufficiency in the production of health technologies into the future to reduce our dependency, to increase health security, to promote economic development, and to improve health and well-being. Just today, we held a meeting on technology transfers to Latin American countries so we can gauge the interest in producing COVID-19 vaccines using this new mRNA technology. But what is very clear is that in the Americas, we need a coordinated regional approach with government leadership, private sector investment, expansion of technological and research capacity, and international cooperation. And this is very true as we look at Latin America and the Caribbean. I want to digress from the Americas to focus on Latin America and the Caribbean. It is only this long-term investment that will ensure that we have all the vaccines needed to curb this pandemic, but importantly as well, that we will have the necessary essential medicines to deal with the whole range of illnesses that threaten our population, that we will have sufficient equipment, and that we will have sufficient supplies. I don't know why we should be importing PPEs and running short of PPEs. Why is this region not self-sufficient in simple things like PPEs? And so we need this to keep this pandemic under control and to swiftly stop the next one. We have to be better prepared for the next pandemic. So thank you again for joining us, and until next week, let us all stay safe. Thank you very much.
Muchas gracias, doctora Etienne. Ahora sí, entonces hemos llegado al final de la sesión.
Thank you, Dr. Etienne. This is the end of our session today. Remember that you can find more information on COVID-19 and the work of PAHO on our website, paho.org/coronavirus, and you will see updated information on the pandemic in the region. Again, thank you very much for being with us, and be safe. Greetings.
Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information, and click on our contact link and let us know how we can help bring your story and help bring us to a better world.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.